Hematologist-Oncologist. A hematologist-oncologist is a medical specialist who focuses on the diagnosis and treatment of blood disorders and cancer. This specialty requires extensive training in both hematology and oncology, which typically takes several years after completing medical school. Hematology involves the study of blood and the organs that produce it, such as the bone marrow and lymph nodes. Hematologists are trained to diagnose and treat a wide range of blood disorders, including anemia, bleeding disorders, clotting disorders, hemophilia and blood cancers, sickle cell disease, neutropenia, hepatocellular carcinoma, leukemia, lymphoma, thalassemia, thrombocytopenia. Oncology, on the other hand, involves the study of cancer and its treatment. Oncologists are trained to diagnose and treat all types of cancer, including solid tumors such as breast cancer and lung cancer, as well as blood cancers such as leukemia, lymphoma, and myeloma. Hematologist-oncologists combine these two specialties to provide comprehensive care for patients with both blood disorders and cancer. They work closely with other specialists, such as pathologists, radiologists, and surgeons, to develop a treatment plan that is tailored to each patient's unique needs. Some of the services that a hematologist-oncologist may provide include 1. Diagnosis. Hematologist-oncologists are skilled at interpreting blood tests and other diagnostic tests to identify blood disorders and cancer. 2. Treatment. Hematologist-oncologists may use a variety of treatments to manage blood disorders and cancer, including chemotherapy, radiation therapy, targeted therapy, immunotherapy, and stem cell transplantation. 3. Follow-up care. Hematologist-oncologists work with patients to monitor their progress during and after treatment, and to provide ongoing care as needed. 4. Support. Hematologist-oncologists understand the emotional and psychological impact that a diagnosis of blood disorder or cancer can have on patients and their families. 4. They may provide counseling, support groups, and other resources to help patients cope with their illness. 5. Research. Hematologist-oncologists are often involved in clinical trials and other research studies to develop new treatments for blood disorders and cancer. Physicians may train to become pediatric hematologist-oncologists where they care for children with cancer, hemophilia and/or sickle cell disease. Some hematologist-oncologists may convert to the field of stem cell transplantation. A stem cell transplant consists of the infusion of healthy stem cells into a patient's body that does not produce enough healthy stem cells. This type of procedure, also dubbed a bone marrow transplant, decreases the risk for serious infections, anemia and bleeding. In summary, hematologist-oncologists are highly trained medical specialists who provide comprehensive care for patients with blood disorders and cancer. They play a critical role in the diagnosis, treatment, and management of these complex conditions, and work closely with patients and their families to provide the support they need during this challenging time.